Welcome, friends. I am Alane Paulley, president of MagnaWave and Orwell. And joining me today is Dr. Alyssa Baumler. Welcome, Dr. Baumler. Every single month, Dr. Baumler and I do a series called Vet Talk. It is right here at MagnaWave, and it's for our certified practitioners or those that are in certification training. It's a way to kind of one-on-one with us and ask your very specific veterinary questions. In this case, we thought we would just introduce Dr. Baumler to the masses, let her answer some questions that you may have about MagnaWave, about PEMF, about usage, and then we're also going to give away some prizes today.
Everybody loves that.
Everyone loves prizes. So if you have any questions, feel free to put them in the chat. Introduce yourself. Tell us where you are watching us from. And we will, just have a good time today talking all things MagnaWave and animals. So how are you doing today, Dr. Baumler?
I'm doing great. Better now that I'm here.
Yeah. Well, I appreciate that. See, it's a little nerve-wracking to be in front of the camera sometimes. So thank you so much for joining us.
It's a little different than when I'm at home. I'm just like with my own computer. I'm here live on set today.
So this is great. We are here. Let's see who we have joining us today. Hi, Bobby. Good afternoon, Bobby. Hi, Stacy's in Colorado.
Wow.
Wendy in New Jersey. Tessa, hey. Alicia in St. Louis. Sarah Witt. Woo, Sarah says from Eastern Pennsylvania. And then we've already got some questions here. So this is a good one. First of all, oh, sorry. Okay, sorry. I thought I had somebody flagging me down here to say something. Anyways, you never know with live video here. So let me go ahead and ask. This question is from Wendy Grogan. Thank you so much, Wendy. I have a dog that had a mammary tumor, and she had it removed. The biopsy came back as cancerous. I'm going to try to put this up here. The biopsy came back as cancerous, but the vet feels he got a very good margin. He knew I used PEMF and red light therapy. He was in an agreement with doing PEMF, but he said he did not use the red light. I was perplexed at why, so of course I asked him, why not? He said the red light brings too much energy to that area and was concerned it could do something if there were any cancerous cells left behind. Any thoughts about this? I have a few thoughts about this. I'm going to start with my opinion here on the red light. Mm-hmm. And first of all, yes, I mean, light affects the cells differently than the magnetic field of the MagnaWave does. And I know that there has been tremendous research in not using red light therapy when there is cancerous cells. It is different. It really depends on the type of cancer cell and what's going on. Skin cancer is a lot different, and even mast cell cancer is different. So, what are your thoughts here? Is that okay? Okay, go ahead.
Okay. A little technical difficulty here with the mic, so hopefully you guys can hear me. But you're always going to run a little bit of risk with any kind of cancer when we don't have clean margins, and that just basically means we weren't able to resect all of the cancer. When they look at that in a lab, they can look at the outside edges of the mass that they removed, and if they're seeing cancer cells still around the edges of the mass, that means that there's perhaps a chance that we left something behind. Especially with, malignant mammary cancer, that's something that's very rapidly spreading. I think, if you've been doing the MagnaWave already, that's great. And I love that you checked with your regular veterinarian because we're all partners in this. So, if he doesn't feel comfortable with you using the red light, I would say, just continue with your PEMF and then hold off on the red light. But I agree.
Yeah, I mean, there is just there's some instances. Okay, you want me to just?
Yeah, just leave it on the table.
I'm leaving it on the table per the boss. Okay, great. So here it is. So I mean, there are some instances with red light and skin specifically where, it's just too much. It does overload. So we want to follow that veterinary recommendation. And thank you for the question, Wendy. Okay, we got Misty in Southwest Virginia. Hi, Misty. Let's see if we have any other questions here. Faye says, 16-year-old mini fox terrier just diagnosed with beginning stages of renal failure. Any suggestions how to move forward from this? Found out via blood test, only indication in great shape, etc.
Okay, great. So when I think about, renal failure, we think about the stages, and you said early, which is good. As hopefully your veterinarian has already explained to you, with kidney failure in dogs, there's no reversing it. The only thing we can do is treat the signs. So this is typically going to consist of fluid therapy, and then pain management for inflammation, things like that. So a great way to use your pain management with MagnaWave is, I recommend around the abdomen area and the sides is where your kidneys are located. There are medications that we can use, anti-inflammatories, but this is a great place to use MagnaWave because a lot of those anti-inflammatory medications are going to be very harsh on the liver and kidneys, and they're filtered through that. So, another mainstay of treatment is diet change, which can sometimes be hard, but, fluid, diet, pain relief is our main concern that we're looking for when we're in renal failure. While it's not something that we can fix, and I'm so sorry for that for your dog, hopefully we can extend the life as much as possible. I would just work with your regular veterinarian and talk to them about MagnaWave, and they can come up with some recommendations for you.
Yeah, slowing the progression, right? Like that's what we're looking at, comfort and slowing the progression with something like, in that area. Thank you so much, Faye, for that question. Brianna says, to piggyback on that earlier question about the red light, treatment for cancer cells or using this on cancer cells is different for tumors that are non-cancerous. And that there is a difference there, correct? Yeah, I mean, they're two different things.
Well, I mean, if you have a mass that's non-cancerous, really, what are we treating? Are we treating inflammation? What is the mass? Whereas when you have cancer cells, those are active cells that are, seeding and moving around. So it is a little bit different, yes.
Yeah. Okay, I have a client that has this is Bobby. Bobby says, I have a client that has a puppy that got its tail docked and it's swollen and discharged. How often should she MagnaWave on the puppy?
Okay. Well, we don't recommend treatments longer than 30 minutes, and that's 10 minutes per spot. So if the puppy is normal otherwise, I would say you could just do 10 minutes on the tail. You can try it like once a day for 5 days and see how we're progressing with that. I think that should be good. However, make sure that she has talked to her regular veterinarian, as you may need antibiotics and other things. The MagnaWave is going to help with the inflammation and the pain. However, infection and things like that is another story. So you still want to see your regular vet and go from there.
Yeah, I mean, using the MagnaWave regularly and even in an instance like this can help the body, especially with relieving that inflammation, but you still need an antibiotic if an antibiotic is needed. It's going to allow to help the body to fight, but it's not going to take the place of regular veterinary care or but a lot of times I was actually having a conversation about this prior to this is when there is a wound that one of the most amazing things that I've seen MagnaWave do is when there is a wound that struggles to heal. So specifically in like older animals where they have like horses or any type of animal that has a wound that they've been keeping clean, the infection there isn't really an infection, but the wound just will not heal. One of the things is just getting that blood flow there without using things where other modalities can do that damage. Like when you use like a shockwave or something like that, you're damaging the tissue. I've seen such amazing results. And I would say, I hate to say it like this, but like I've never had a case where somebody told me they've tried it on a wound that won't heal and had it not work. Like it is something that is very worth trying, because what else are you going to do? Right? Like if you're in that situation, there's not a lot you could do if you've tried things.
Yeah, and I mean, it makes sense because, I know some of you guys are new here on the live today. With the MagnaWave, we're increasing circulation and oxygenation, and of course, that is one of the building blocks in wound healing. So any way that we can bring more circulation to an area, improve oxygenation, that's obviously going to help speed up the healing process.
Yeah, just something to keep in mind. I don't know why I went there, but I did. It was happening. Okay, thank you so much, Bobby, for asking that question. Bobby says it has discharge from it on the tail. I don't think that's not the same as like active bleeding. Like, that you will definitely get the infection.
Discharge you're talking about. If you're talking about like pus, like purulent discharge, that's more so a sign of an infection. Now, if you're having active bleeding, blood gushing out, obviously that is a contraindication for MagnaWave. So
yes, yeah, exactly. If you have any blood gushing out, call 911 or go directly to the vet, in this instance. Anytime with
Yeah.
any body or human or animal, blood gushing means you need to go to the hospital or veterinary care. This one is interesting. Tammy says, do you recommend checking with your vet prior to using MagnaWave on older animals, particularly senior dogs? And I'm going to say this, Tammy, anytime that you are working on an animal that is under veterinary care for an indication, you want to let them know that you're adding a modality in. So if that dog is on a ton of medications, it doesn't necessarily mean that you need to get the clearance on every single time that you work on an elderly dog, but you definitely want to let that veterinarian know that a modality has been added into their care. But if they are just a senior dog that really doesn't have a lot of issues and isn't under any bunch of medications, they're just older, doing a session doesn't mean you have to get a doctor to sign off on it.
Mm-hmm. Of course. I think if they have a veterinarian that cares for them all the time, and like Alane said, they have pre-existing conditions, it's always a good idea to talk to the veterinarian, just because nobody wants to feel undermined. And I mean, we're teammates here. We're not working against each other. But yeah, I think it's a good idea to talk to the vet.
Yeah, always letting a vet know that you've started something else is good, right? It's always good to talk to that veterinarian. But I don't know of very many veterinarians that would be mad if you gave your dog a massage without letting them know. I mean, that's essentially it's even MagnaWave is less invasive than a massage, actually, which is pretty interesting to say. But yeah, so just senior dogs who maybe have some issues with just aging issues and maybe pain when they get up or movement and stuff like that, where that is normal stuff that you could easily do on your own dog at home. It's not necessarily something that has to be cleared, but anybody under any type of medical care that is taking a lot of medications, definitely you want to loop their primary caregiver in. That is something extremely important.
And of course, if you're working with someone whose veterinarian is being a little bit more difficult with you, or, just not understanding, you have plenty of liaisons between me, Alane, and all the staff here at MagnaWave. You can always reach out, and we're happy to kind of help get you moving in the right direction.
Yeah, that's a great point. So one of the great things that the certified practitioners have here is Dr. Baumler is available for questions by email throughout the week whenever you need that. So if you ever have a situation where maybe a vet doesn't understand it, first of all, if I was a certified practitioner, I would go into the portal. I would go to the media resources. I think that's where it was, the media library, and I would look for any of the explainers, information. Another great way to talk about what we do and explain that to somebody is this amazing book.
Today, you are stepping into the future. The science of post-electromagnetic field.
This is the video booklet. There are preloaded videos that come on it that explain MagnaWave. This is a great booklet to help, but all of it to help you explain things to your current customers or new customers. But it's also something that these videos are also available for you to download and share just from our media library if you're a certified practitioner. So if you had something that you wanted to send to a veterinarian that has a really good pictures and information in it, it's there. Also, here's something else I'm going to share that I also was going to share with you, Alyssa, is it's gonna happen. Hold on. We were actually featured in, specifically for small animal vets, we were featured in the Dog Doc, which was a really great documentary that had Dr. Marty Goldstein. He is the foremost veterinarian in holistic care for animals and natural healing. He has literally paved the way, and it has won so many awards, and it's called the Dog Doc Sit, Stay, Heal. DogDocTheFilm.com. MagnaWave is featured pretty prevalently throughout that documentary. Just something to share with your veterinarians and people that, what you're really looking for is legitimacy, right? That's what they want. They want legitimacy. And so using the studies, the flyers, the information, the videos, and sharing with them different resources of other veterinarians, and even allowing them to maybe send you a question that you pass on to Dr. Baumler, then that we can facilitate, is an excellent way for you to communicate with your veterinarian. Okay. Timing suggestion. Timing suggestion for post-surgery recovery from partial anal gland removal on a large size dog.
Okay. So we're asking when you want to start treatment after you've had that surgery.
Mhm.
Okay. I would say, obviously wait a couple days after surgery because you want to look out for any active bleeding. As long as your vet did a good job, there shouldn't be any active bleeding right after the surgery. However, just to be safe, I would say wait 2 to 3 days after the surgery to make sure everything is good and healed. And then from there, like I said, you can do 10 minutes on the area with a certain loop. I like to use this large loop and lay it kind of over the hips on the dogs. This is also good to go over the shoulders, or you can even put it around the neck of the animal, and it works really well. But I typically, if the dog will allow it, do 30-minute sessions, and I'll do 10 minutes in different areas. And then you can use different attachments too. So you might do the large loop on the hips. A full body session is never going to hurt. We're just treating the anal sacs, but to treat that dog overall, while you're already there, you might as well do the 20 extra minutes on another area of the body. So you might use your small loop later on and put it around the leg or the thigh. It just depends. And it's all, what the dog will handle and what it responds the best to, really.
Okay, so I concur. 100%, I agree. There is a question. Thank you so much, Sarah, for that question. Here's one, and I kind of want to tell a story before we pass it to you. Sarah asks, are there any special precautions that should be taken working on a dog with mast cell tumors? So I just want to tell my personal story of my dog. I had a dog, her name was Ella. I had her for 18 years. She got a mast cell tumor at about 11 years old. She wasn't eating. It was right on her neck, and it was very big. Couldn't be removed because it was really big and where it was. And so there wasn't a lot of options for me at the time. One of the things that I aggressively did was I changed her food to get her to eat. We went to a fresh diet, no more of the kibble or whatever, the dried food. And then I started aggressively MagnaWaving it. I was actually able to get, and I was working with Dr. Marty Goldstein at the time to get the tumor down. And again, with this indication, I was working with the veterinarian and I didn't have any other choice. Like there wasn't a lot of choices for me to do that would help my dog at the time. So I was able to shrink the size of the tumor to a size that they were actually able to remove that tumor from the dog's neck. She actually lived, as I said before, I had her for 18 years. This was when she was 11. So she lived several more years. And actually it was pretty miraculous how much better she got. So I think, again, mast cell tumors are extremely aggressive. And from what I understand, any work with them just needs to be done under the care with a veterinarian. What do you think?
Of course. Yes. I think, of course, if you're in a situation like Alane and it's an inoperable tumor, what other options do you have at that point, But also, if you're working with your veterinarian and you're making sure that they're approving, what you're doing and they're giving the right recommendations, I don't think there's an issue with it. We just want to be careful. But, it's either removal of the mast cell tumor or, nothing at all. So it's kind of like, what are your options at that point? Now, as far as removing it and then doing the MagnaWave after, that could also be beneficial. A lot of the times, though, when they remove that, they'll send it out like we talked about earlier and look at those margins, and that can help. I will say a lot of the time, even after removing a mast cell tumor, there is a chance that once your dog has one, they will get another one in another spot down the road, just statistically. But I think it can be very beneficial.
Well, and my dog did, but we were able to keep them at not until she was, I want to say like 15 or 16 is when they really started. But I went from like really at the time, she just seemed so healthy her first 10 years that it was like, oh, you don't think you need to MagnaWave them. We think, oh, my dogs, it's always until something is happening that we all of a sudden think we need to add it in. I wish I would have started when she was like anywhere from 6 to 10. Like I wish I would have started around that time, just doing maybe twice a month just to keep her at her best. And I feel like that would have been the difference between possibly some of those things coming along as she aged.
Well, and you have to think, with the MagnaWave, we're also shaking these impurities out of cells. So like Alane said, this is great preventative maintenance as well for your dog, just overall wellness. Just like anything you would do for yourself to keep yourself in tip-top shape.
In the comments, I'm putting a great interview. It is long, and it is my dad, and he has amazing mustache in this interview, okay? But this is with Dr. Marty Goldstein. I'm putting that in the comments right now. If you are looking for information or want a little bit more to dive in about the dog doc, that is there. He also has a really great book as well. Okay, let's see. Okay, so we got Tori starting to work on a small dog for an ACL tear. Hoping to see improvement, they are recommending surgery, but also recommending therapies. How often do you recommend doing sessions? This also happened to my dog. She tore her ACL, and we did twice a week, maybe 3 times a week in the beginning. Amazing results. She ended up not having to have the surgery. So what do you think? Is that a good number or?
I think it's good, but it also depends on the dog and what they respond to. Now, you could have one person who has just a partial tear, somebody who has a full tear, and that's going to affect, how things work. It depends also if you do decide to pursue the surgery and then you want to do that as well, that's going to change the amount that you're doing versus just doing the MagnaWave alone. So I think that's a good place to start for sure, 2 to 3 times a week if we're not pursuing surgery. If we are pursuing surgery, obviously we want to be careful with this after, the procedure is done. If you're doing this on your own without, veterinary help, I would advise treatments once a week. That's typically what I do for CCL repairs at the clinic. We will do one immediately after the surgery because we are in a controlled veterinary environment. And then after that, we'll do it once a week, typically for about 5 to 6 weeks.
So that would be where they're bringing the dog to you once a week. But let's say they had the option to do it at home. Could they do it after the surgery if they were cleared by you to do it twice a week?
You could do it twice a week. We just want to make sure that we're following whatever guidelines you were given by your regular veterinarian as far as exercise restrictions and things like that.
Yeah, because you don't want them to move around too much.
You don't want them to go crazy for sure right after surgery.
All right. Thank you so much, Tori, for that question. Here's a good one from Kathy. My horse has toxic amounts of aluminum, lead, mercury, and arsenic. Arsenic. Wow. Can the MW help get rid of these toxins? He's on medication at this time. Now, I know that there is some detox issues, but I mean, I don't know how yeah.
It's hard to say. I work primarily small animals, so I can't give you any personal knowledge on this. As we said earlier, it is going to shake the cells and shake some impurities out of the cells. However, if you think about it on the human side of things, it sometimes can make them a little bit sicker, just like people who have alcohol problems or heavy smokers. So if your horse already has all that in its system, could it help? Potentially, but it may get worse before it gets better sometimes.
Exactly. That's what we notice in detox. When anything is detoxing, it is where healing hurts, right? Like as those things move out of the body, it can be very uncomfortable. So that's something to keep in mind. I would just do anything under veterinary care. I like to think when we're detoxing, think of it like sauna. If you are going to be putting a dog, like a dog or a horse, or if they are sweating, what is that? Talk to a vet in those terms. Like, what is that going to cause, and what comfort? They may have some feedback for you in that instance. Okay, here's another one. We have Vicky says there's an 8-month-old mastiff that has cranial thoracic vertebral canal stenosis. Wow. This is rare in dogs. The dog has been in pain and ataxia. Surgery is scheduled for 10 days from now. The neurologist did start steroid injections to decrease the nerve inflammation. Do you have suggestions for pre and post-op treatment?
Okay. My first question is that helping the pet? One thing we have to think about with injections and things like that, if it's steroid injections, and I don't know, did she say if it was injection or oral?
Injection.
Yeah, we don't want to be, MagnaWaving right around the area and injection was given right afterwards, just because it does increase circulation and blood flow. So we don't want to, lessen the time of the steroid for less than it was intended. We don't want to speed that up too much in the body. However, it's very good with inflammation. There are lots of times that we use MagnaWave with intervertebral disc disease and things of that nature. Now, I'm sure there's not any kind of protocol in the app, and we'll talk about that a little bit more afterwards for you new guys about the app for your specific request because it is rare. But, I would start slow. A lot of it is body language and seeing how the dog responds. So the area that's affected, so you said thoracic, vertebral, you want to focus over that area, I would do 10 minutes to start out if the dog will allow it. And then picking the power, that's going to go based on body language. So if the dog seems like it's doing well, it's not fidgeting, not moving a lot, just relaxed, that's great. Typically, when I do my patients, what I find is most comfortable, and this is not for everyone, but most of the time, is around between 4 to 6. But it's really just watching the dog, and you're going to get a lot of those cues. They can sometimes be subtle, but it's really just, is the dog comfortable? Is it laying there? Is it trying to get up? If it's trying to get up and walk away and it doesn't like it, then obviously what we're doing is not working.
Great. Here's another one. What effects would MagnaWave have on hyperthyroidism in dogs? Now, I think it's pretty rare for hyperthyroidism in dogs, but I have heard of some people who have used MagnaWave in the past and seen some beneficial, but I guess it really is it what's causing that is definitely a case. So could it be beneficial? It depends on what the cause is. What do you think?
Okay. Are we talking about hypothyroidism?
Yeah, hypothyroidism.
Hypothyroidism. Okay, so, with hypothyroidism, that means our thyroid is not functioning as well as it should be. In that case, a lot of the times you're going to need medication to see results from that. However, for things such as like weight gain and things like that, by letting them lay on the mat and things like that, you may see an increase in digestion. I don't know if anyone here has ever used the mat on themselves, but you can feel your gut start to move. So I don't think it's going to, fix your problem completely. If your dog is truly hypothyroid, medical intervention is probably needed. However, there are some ways that it can help treat the symptoms, such as like the weight gain. So, your metabolism is going to be a lot slower if you're hypothyroid. It's not going to be the end all be all, but treatments on the mat and things like that could help with digestion and things of that nature.
Great. Thank you so much. Let's see. Kelly is asking, is there any studies we can share on PEMF? Yes, Kelly, there are lots and lots of studies. We have a research tab on our website. Also, the AOPP, PMFprofessionals.com, has a ton of research. MagnaWave has done studies on the hoof. We have done studies on, we're in the middle of one with dairy cows. We've done several other studies. So yes, there's lots of research we have out there. And then somebody asked where they could buy the video booklets. If you would like to get a video booklet, it is in the practitioner portal. This is something that is offered to our certified practitioners. It is in the practitioner portal, but we also have the link to that product in the comments. Okay.
Oh, yeah. I told him we would talk about the app. Do you want to talk about the app for a second?
Yeah, let's talk about that.
Okay.
So what do you want me to talk about? What do you want me to say?
Just, a lot of you guys have all these questions and we're always here for you. But a great place to go is the app, especially if you're new to this and you're thinking about buying a machine. Don't think you're just going to be in the dark. We have a lot of protocols that are already pre-made where you go into the app, look it up, especially if it's a common condition that we're treating a lot. So I think there's one for CCL tears and things of that nature.
There's literally hundreds of protocols. There's guidelines for pretty much everything.
And then if there's not, obviously we're here to help you too. But I think that is a really great tool that a lot of people,
First of all, we're the only PMF company that has a mobile app that is chock full of guidelines. You can actually track your sessions. There is an outline of a horse. There's an outline of a dog. So let's say you are working with a veterinarian and a veterinarian says, yeah, go ahead, do some sessions. Well, after you do that session, you can actually show where you place the coil on that dog by dropping pins. And then you can email that directly to the veterinarian, say, hey, thank you for allowing me to work on this animal. Here's where I saw those areas of sensitivity. That's great information for that veterinarian to have. It also shows respect for that veterinarian and what they're doing and allowing them to use that data in with their work on that animal. You can send it to the owner and the veterinarian. So besides having guidelines for everything, a majority of everything, you can always email education@MagnaWavePMF.com and reach directly out to us, which they will get that information to Dr. Baumler so she can answer those questions if you email education. But we will then, if you would like to see a guideline added to the app, just mention that in your email. If it's, something that's we're getting lots of questions for, we automatically go add those into the app. So you people wanted to talk about that?
No, I just brought it up and said that we would talk about it a little more.
We're talking about it. It's available in the App Store. Go to MagnaWave. There's 2 MagnaWave apps. One is for the remote control. So if you have a remote control, able machine, which is the Julian and the Maya Pro. Those devices have a remote control that comes with the remote, but you can also use the mobile app. Then there's a second MagnaWave Guidelines app that is also available. You want to make sure you download the correct one based on your needs. Okay, here's a great question. Julia says, we have a new young vet in our community. What would be the best way to introduce myself to her?
That is a great question. I feel like I need to make a handout just on this because we get questions about this all the time. You know, a lot of it is just kindness, forthcoming. First thing I would do, because if you go into your vet's office and just say, hey, I want to talk to the vet, you're probably going to have a hard time with that just because we do have appointments most of the day. So I would call up there and talk to the office manager and set up an appointment to speak with the vet. It never hurts to bring something with you.
Food, bring
You can't
food.
be bribed. No. Just kidding. But in all seriousness, like, it's always a good, nice gesture to bring something with you. And then the video booklet is great also. Having resources to show your vet and explain things is going to be your best friend, just because even as a veterinarian, it's hard sometimes to be able to explain, you know, in scientific terms to what some people are wanting, you know, how this works. Bring the machine with you, do a demo, offer to do one on them, offer to do one on one of their animals. As long as you're nice about it and you don't come in trying to tell somebody, you know, what you're doing, it is more as if you're sharing your knowledge and offering something, it's going to be a lot more well accepted.
Yeah, just introducing yourself. What I've always found is walking in, always bring food. The person that, especially if, okay, there's different types of vets. There's veterinarians for large animals. They usually maybe they're not in their office every single day. They're driving around in their car or whatever. So what I would do in those situations is going up, introducing yourself to them when they don't seem overly busy. Okay, that's one thing. Maybe giving them something like a box of cookies with your business card on it, something like that. Say, hey, I'd really like to introduce myself. I'm so-and-so, and I'm a MagnaWave practitioner. I have all sorts of wellness modalities. If you ever have somebody that you think could benefit from, first of all, I ask, have you ever heard of me? Have you ever heard of MagnaWave or what these things? If they say yes, no, whatever, but then if they haven't, then you can say, well, would you mind if I take your card so I can email you some information? If they don't, if they have, then just saying, you know, if you ever have any questions or I could be of service, or if you have any animals that may benefit, I would love to work together to, you know, help all of the animals that we love so much, because you don't become a veterinarian unless you do. Small animal vets that do have a physical location, you want to bribe the front desk person.
Yeah.
I mean, that's the key to get in. So you want to bring a bigger box of either donuts. I really like pre-sliced and bagels that have been toasted with cream cheese. That will get you in. Dropping off a video booklet. You can always come back and get the video booklet the next day with those treats, and just saying, hey, can I get a time to do a lunch and learn or meet with the vet? Food is the way to anybody's,
of course,
heart, I guess.
I think the video booklets are really effective too, because I mean, how many times do you go to the doctor's office and somebody hands you a pamphlet on, oh, this or that, and you're not really reading it? You'll take it home with you, but you're not really going to read it. This, even if they don't want to, they're going to be interested because you never see this. They're going to try and figure it out, and that alone is going to make them watch the video just because they've never seen a video pamphlet before.
Yeah, I mean, it is really cool. The great thing is it's rechargeable. You can change the videos. You can turn it up, turn it down, the volume, pause, press play. It's just a really great thing. At the top, we have a sticker that says, do not discard booklet. Please return to practitioner. There's room for you to put stickers of your own business on the front and on the back with your contact information. What I like to do is drop it off with the food and say, hey, I'm going to come back tomorrow to get that booklet. And this is a great way for, as they're eating their bagels or donuts, to check it out. It's definitely, even at a show, when we take these to dog shows and we have them, people just attract to the booth as they're playing to check it out. It's a really great resource.
Another thing is, if you have videos of your own personal testimonials, like you can show a before and after video, results are really what's going to get people. And that's like with most of the drug companies that come to visit vets' offices too. You know, we want to see the product, the science, and then we want to see results that it really works. So,
and those before and after videos, if you edit those yourself or put those together, you can add any video to this. It doesn't have to be any of ours. It could be one of your own. Okay, this is interesting, and we have worked on a lot of birds in the past, so I like this one. Bobby said, a friend has a parrot that has a broken wing. He doesn't sit still long. Would it be okay to MagnaWave him holding him or sit him in the butterfly loop. I've actually seen this happen, especially with an eagle, where we worked on an eagle that had a broken wing. I mean, the birds liked it. I mean, they ended up sitting in the coil more than we thought. So
That's
what do you
so
think?
cool. I haven't had the opportunity to work on a bird yet with MagnaWave. I don't see the problem. I can see them wanting to perch or like grab onto something like that. So it makes sense to me. As long as you're not doing it with the bird like in the cage or something, obviously, because we don't want to have metal interacting. But yeah.
Yeah, a lot of times what we've done in the past is just place a towel. And then they usually, when they have that, they actually like it, like, and you keep it very, very low, but just having that on the lowest setting and allowing them, it's amazing how animals use magnetic field for a lot more than we realize. They found that for migration patterns, and a lot of times that we thought it was weather, but there is a lot to be said about how animals migrate based on the magnetic fields of the earth, and they are way more in tune with that. So they tend to, like, if it's beneficial and feeling good to them, they like it. They're not going to get up, move around that, but if it's not, they do. So you know pretty quickly if they're comfortable or if they're not. Same thing with the bird. Even if they're bouncing around, once you start, they're going to decide if they like it and need it or not. But yeah, go ahead. We've worked on lots of animals. Let's see here. Debbie, this is one that I will answer. Is there a cold, hot temperature where MagnaWave is not recommended? Example, negative wind chills. No, there isn't. I mean, there isn't a reason why you can't do the MagnaWave and negative. I'm assuming that you mean like either on the animal, is there a problem? I don't think having an animal in negative wind chills is a great idea. But is it bad to use the MagnaWave on them? No. Is it going to damage the machine? Shouldn't. So no, you just don't want to ever leave electrical technology like this outside in extreme heat or extreme cold, like for long periods of time. Do you think there's any reason that you couldn't use a machine at any time?
No, and I mean, especially with equine practitioners, you know, you're doing farm calls most of the time. So it's going to be hot some days. It's going to be freezing cold. And we haven't had any issues with that or complaints from our equine practitioners. It's more so just like Alane said, obviously the only time temperature really matters is just storage conditions. Don't leave your machine outside, obviously.
Yeah, I mean, we have a lot of horses that suffer from anhydrosis, and we've had a very great results using MagnaWave to help to get them sweating. So that's something that is very interesting. But one of the main things that I always talk about with heat is, especially extreme heat, is, are you hydrating as a practitioner? Like, are you hydrated? Like, are you taking, drink a Gatorade, get some sort of fluid, make sure, because a lot of times that's more of the problem, is that you're doing too much in the heat than the animal. So there we go. Here we go. When you have a very small dog, i.e. 10 pounds, wouldn't a treatment to any area actually treat the entire body? Pretty much.
Yeah, I mean, I guess it depends on what you're using. So if you're using a large loop, you can probably set the dog in the middle of the loop, lay it on the mat. Now, if you're using your little small loop like this, it could still go through the whole dog lengthwise. However, you're not probably going to get it around the whole body, but you could use this on the whole body.
Yeah, like you said earlier, a full body session is never bad. I mean, you're oxygenating all of the blood. So you can target the area where the issue is. But if you do a 5-minute full body or 10-minute full body, whatever, right after you do a targeted session on a big dog or small, just do a small dog. It's better than not doing it.
Yeah.
Okay. This one is odd. It says, I'm going and seeing a Mennonite family that doesn't use vet care, and they think their horse has SDFT. Should I work on that horse or not, especially since they don't do vet care? Well, first of all, this is not something that we've worked with tons of Amish and Mennonite over the years. I was surprised at how many Amish people have purchased machines from us. I mean, I'm talking maybe 100, if not more, that have purchased MagnaWaves over the last 15 years. Very common because they don't have veterinary care. So the SDFT is the superficial digital flexor tendon. It's a major tendon in the lower leg. So yeah, I guess the question is this. They don't have veterinary care, so should I still work on their animal? In my opinion, Yes, because they're not going to have any veterinary care, regardless of if you work on the animal or not. So if you can make the animal feel more comfortable, then and you can, help, then yes, I would absolutely work on them. The main thing is if they do have veterinary care with anybody is to make sure you're communicating the needed information to that veterinarian. You want to make sure that the veterinarian is respected and that they understand what you're doing and that they understand how the machine is used. And that goes with any type of body. Even if you are ever working with somebody who's a human being and they're working with a doctor, they need to know any modality change that happens within that person when they're under medical care. So, but if they're not working with a vet, then they're not going to do anything anyways, right?
It's just kind of like, what do you have to lose at that point? If they're obviously not going to be going to a vet regardless, you just need to let them be aware of all the contraindications like you would anyone else. But you don't really have anyone to check in with at that point. Now, if things start to go awry, obviously, pull back on treatments. I don't foresee that to happen. But if something was to happen, you don't have anyone that you're checking in with. So,
all right, I'm going to answer this question because I just need to answer. I need to answer this. All right, Caroline, I posted about this in the practitioner group because I saw in previous posts that 7 hertz is best for bone healing. I fractured my finger is wondering why what setting 7 hertz would be on the Soul Pro. I'm so excited about this. Okay, so the reason that I want to address this is because Caroline, I do not want you to overthink this, okay? The reason that you have ever seen a post that says 7 hertz is optimal for bone healing is because a study was done. When a study is done, you have to pick a baseline to measure against, okay? You have to pick something to say, this is what we did. This setting is what we used. This is what we did, so that when the study is recreated, or somebody else does that, right? A medical professional does it, that they do the same thing, or they decide a different baseline to go against to show improvement, right? So it's got to be a testable theory. It has got to have one specific setting. You cannot give them the settings of 1 through 20 like we have, and then everybody uses different ones, and then we go and we say, look, the machine works because there is no baseline to judge against. The bone healing study that you referenced used 7 hertz. That does not in any way, shape, or form mean that 7 hertz is optimal for every single person or animal that uses PEMF. Okay? It's not the case. Other studies have been done on different settings that are just as beneficial, right? So I think the main thing to keep in mind is magnetic fields fluctuate. The way the magnetic fields, and I'm sure if you've ever felt what I'm about to describe, please comment below or in the section where what was comfortable on an animal one day was not the same on the animal the next day. Okay. If that has ever happened, please tell us. And I'm going to say that is my exact point for saying that what works for everyone is not the same. No body is the same, not even from the same person day to day, let alone all of us. So 7 hertz is, we are within the range of 7 hertz on several settings on the Soul Pro. What you really want to do for optimal bone healing, for what you're working on an animal or anything, you want to make sure that you are setting the machine on what's comfortable for that animal getting the session, right? Or that customer getting the session, right? You don't want, what is comfortable is the optimal setting for what is good for that body. Did that make sense?
Yeah. And I mean, there's a lot of places where even on a super high setting, you're not going to feel a whole lot just because there's not as much, tissue that's being traveled through. So like a lot of the times when people do their knees, they'll be like, I can't feel anything. So it's going to be different for everybody.
Right. And the same with horses, where people will say, oh, I'm working on this area, right? And I can turn it up to this setting of very, very high on a horse's leg, but you can't on another horse's leg, right? So every body is different. So I think that one of the things that's holding people back in the PEMF industry, and this is something I'm extremely passionate about, if you couldn't tell when the question came up, is because I think that clinical trials and studies are important. They are. But because of lack of understanding as a whole, because we are used to prescription. We are a prescription society where we want to be told, take 2 pills a day, 7 days a week, or whatever it is for so much time. You want this exact way. And that's not the way that our bodies and our like natural bodies are. Even if you do take, let's say a certain weight takes a certain amount of medication, when somebody's prescribing medication, that may not be optimal. Maybe somebody's liver can't handle that amount, even though majority of people could when you're dealing with medication. So one of the things with PEMF as a whole, it's what matters is the comfortability and the feeling. You don't have to actually feel the MagnaWave for there to be optimal results. And the animal doesn't actually have to have muscle movement. But in terms of what is the optimal setting is looking at the eyes, looking at the ears, the comfortability, the movement of that animal, like if they're getting up and moving away, like Dr. Baumler said, is very important. But especially with horses, you may see them actually move into you where they want you to do an area on their back. And people think, oh, well, I was working up here by the neck and then the horse walked away. But really they're pushing their behind into you because they want you to MagnaWave that area. So I think we listen to the body and listen to the body of the person. But yeah, 7 hertz is beneficial. But in terms of the exact setting for that, I would just do what's comfortable. I hope that made sense. Raven, here's a good testimonial. Raven Rucker said, MagnaWave kept my dog's cancer at bay for a few years. It really worked, which is something I was talking about with my dog. Okay. Jessica says, I've been doing sessions on a dog that had an injury jumping off a tailgate. After 2 sessions, she was running and jumping around again.
That's awesome.
Hey,
that is really awesome.
Okay. We only have a few more minutes here, so we want to make sure we get as many as we can. Beth says, I have a dog with an open area from removal of a cancerous tumor, not healing well. Is it okay to PMF? What would you suggest for frequency? Any issue regarding the cancer?
So it kind of depends what kind of cancer we're dealing with here. If the wound is non-healing, is it not healing at all, or is it slowly healing? This is a great time where you want to consult with your regular veterinarian to see recommendations, of course. If the question is just, could MagnaWave be beneficial to wound healing? Of course. However, we would need to know what type of cancer we're dealing with here. And it's ultimately between you and your veterinarian if that's something that would be beneficial or not.
Yeah, you have to also understand as providers of these machines, we can't tell you that MagnaWave is across the board safe for a certain type of cancer or not. I mean, there's a tremendous amount of education and research that has to go into that. So that is 100% on the caregiver, the doctor who is working with that animal's call. But I would encourage you to do your research, and then also bring that research to the veterinarian when you're speaking with them. But yeah, if the wound isn't healing at all, it's very much similar to my dog who had the tumor. Like, if you don't have any other choice, that's something that the vet would be more open to trying. I noticed that one time with a horse who had colic. Mm-hmm. And this I believe this horse was like 2 or 3 years old, very young, severe colic, was down. They couldn't do surgery because of the way that the twist was. And so they said, we're going to, there's nothing we're doing, we're going to put the horse down. The vet had said, we're not doing any modalities prior to finding out that there was nothing else they could do. After that, the vet said, do whatever you want. We're going to have to, put the horse down anyways. We did a full body MagnaWave session twice. Not only did the horse stand up, defecate, move forward within 48 hours, fully functioning back to the horse. It actually happened. The horse went and ended up winning like millions of dollars in races, but it happened twice. Colic 2 more times in his life. And each time MagnaWave sessions twice and back up again. So at that point, a lot of doctors are more open to seeing things like that, but that's something that you make that decision with the veterinarian, not on your own. Okay, here we go. Jessica says, thoughts on how often you should MagnaWave older dogs for maintenance purposes?
That's great. And that's another thing where we go back to, how does the dog handle it? I would say if you want to start doing it like twice a week, see if you're noticing improvement or if it's a little rough on the dog. If you're noticing improvement, you can go up to 3 times a week. It just depends. Every dog's going to be different. Like every person is different. So you really just want to watch how the dog does after the sessions. Sometimes if you do it too close together, just like if you got a massage every single day of the week, you might start to get a little bit sore because you're having a little too much. So you just really want to see how the dog responds. But I think in an older dog, maybe start 2 to 3 times a week, and then you can go up from there.
I agree. Good, nice answer there. Here's a good one. Where'd it go? This one's about glaucoma. Tori said, another question about glaucoma and high pressure in the eye. Does MagnaWave aid a relief, or because of the oxygen and blood flow, does it make it more painful? And we have actually seen research where using PEMF with glaucoma has had really great results. What do you think? Would you try with glaucoma?
I have a glaucoma dog right now, actually, that I've been treating. So that's a great thought to try it on. I haven't had the opportunity to do that yet, but I think it's definitely an option because with glaucoma, it's not something that's reversible. It's not going to get better. You treat the signs, and eventually the eye does have to come out, and then eventually it spreads to the other eye over time. That is what we know. So anything that's going to help that dog stay out of pain, because as I'm seeing with my patient right now, a lot of the times the medications aren't enough. So if it's, keeping this dog out of pain a little bit longer or removing the eye, sometimes the owners might not have the financial ability to just go ahead and remove the eye. So I think it just depends.
I mean, there's been several studies that have shown that PEMF is beneficial for glaucoma. I know that there's several on PubMed. So I have heard of this being used across the board. So yeah, I would absolutely use it if you have the ability to do so under the veterinary care of, with the veterinary's approval. There we go. Here's a good one. I am currently working on completing my certification. Obviously, you don't want to get wet or submerge the coils or machine. Is it okay to work on wet animals, particularly horses, if they are sweaty? Yes. That was quick. Okay, yes, it's fine. It's totally fine. You're absolutely right. Okay.
Your coils might get a little nasty, but it's okay.
Yeah, one of those things, like get some coil cover, get some attachment covers and use them, and then let those attachment covers dry. Let's see. This is one of my favorite questions. If you had to choose one attachment to purchase, what would you choose?
For me, I like the large loop. This is my favorite one. This is what I use the most. It's really versatile. You can kind of maneuver it to be like the small loop. And that's being small animal oriented. So I guess I don't know if that would change if you're using large animal, but this is my favorite.
Ditto. If I was going to do anything, that's why this comes with every machine okay, there we go. That's why the large loop comes with every single machine that we sell. So does the butterfly loop. Initially, and I'm going to try to pull this around without knocking it. Initially, when the machine was first sold, we only actually ever used the large loop. My dad liked to do this a lot, which created the butterfly loop. Because this is not great for the large loop to be done to the large loop all the time. These are copper in here. And the more that you bend that copper and do stuff like this, you can't cause that copper to break. So that wasn't great. So that's led to the creation of the butterfly loop. But this is everything to me. I mean, people always ask me, should I get 19 loops with my machine? I'm being exaggerative. Okay, when I say 19, we don't actually have 19, but should I get everything, right? Obviously, a smart answer as a businesswoman would say, buy them all. Yes, no, you don't need anything, in my opinion, but this to do everything that you need to do. Now, as a large a lover of horses and somebody who works predominantly on larger animals, the XL wave wings are great. The mat is great. Those are excellent. But especially when you're first learning, this is the thing to use. You really understand movement. You understand how to use it. You understand placement. And then you could get some of those larger attachments and those other things as you go. I hate to say it. I mean, I know that that's not the best business answer, but it is the correct answer.
It's honest.
It's true. Let's see. Here's one. I know incontinence is approved indication for humans. Is it helpful, for dogs as well?
I don't see why not. I can't promise that it's going to work on every single dog, but it's not going to hurt to try if that's your only option.
I agree. Let's see. I'm trying to find some good questions that are a little bit different before we have to wrap up here. We are giving away 4 things today. That's exciting. Bobby says, this is just a question I'm going to answer really quickly because people want to know. Alane, I'm sorry, off topic. Can we take our machines through metal detectors or will that damage them? I have a meeting Friday to meet with a couple doctors and I have to go through metal detectors. You are fine, Bobby. Go through metal detectors. You could go on an airplane. You could go through TSA. Let's talk about going through TSA real quick because everybody asks. When you go through TSA, when you're going to the airport, whether you're using a digital machine like the Simi 10 or a large spark chamber machine like the SoPro, the Julian Duo, those machines actually look like they have bombs inside. There is a huge spark chamber that looks like this. It's a big ball. That is not always the best thing that they want to see when going through TSA. So allow yourself at least an hour and a half extra on top of what you would usually go to the airport for. Majority of the time, you will get through no problem. They will ask you some questions about what it is. I like to carry some trifolds or pamphlets or something like this, the news and views with me. Very easy to show them that this is what the device is and how it works. They may do some of that bomb fluid stuff on it to make sure there's none of that residue that they search for. But yes, you could go through. I recommend never checking any type of MagnaWave device. Always carry it onto the plane. But when going through, allot yourself the time. I have traveled all over the world with my MagnaWave devices. And I've been stopped a handful of times. And sometimes they even bomb squad person comes down. They look at it. They swab it, say, oh, you're fine, bye. But that's just because the TSA people are being overly precautious, making sure that you're safe on the airplane. So that's a good thing. But don't worry. It's just they haven't seen it before. Okay. Let's see. I don't know what an L&L program is, Debbie said. Okay. Let's see. I chat with my own vet when I take my dogs in for care. Not sure if it's considered competition, even though I've explained that it is not in any way. Still working on it. Do you feel like it's competition?
No, honestly, I wish I was able to use my MagnaWave machine more at the office. Really, it's a great partnership because a lot of the times we don't have that extra 30 minutes to just take up an exam room to have a dog come in for a 30-minute session, and I do it when I can. But, if you have the availability to be doing that more, a lot more of our time is going to be based on less therapeutic treatments and more so, diagnostic exams and figuring out what's going on with a pet. So I don't consider it competition, but I'm also well-versed in, what MagnaWave is used for. And it's, a therapeutic tool that can help.
The reason that anybody would look at it as competition because you are speaking as though you are competition. So it's about how if you are going in and pretending to diagnose animals, anyone that I've ever seen get in trouble for practicing medicine with a MagnaWave, every single time they have said things like, oh, well, that's not what the vet said. That's this. Based on what my MagnaWave showed of sensitivity areas, that's this. That is every single time. They've always had other modalities that they're using, and they are crossing the boundary of their knowledge base. MagnaWave is just like anything else. It is a modality that's added on with regular veterinary care. And veterinarians, just like you said, they don't have time.
Yeah.
They really don't have the time. The reason that any veterinary boards or vet boards are upset is because the people who are using the machines are crossing that line. And that could be with anything. It could be with acupuncture. It could be with massage where you're saying that's not what's wrong, or I don't agree, or I think it's this, not that. That's when you're crossing the line. You need to be listening to what the veterinarian who went to school, who is able to make those decisions, does. And then you need to take that information and use your MagnaWave guidelines to do what they say is the problem and address it that way. Most veterinarians do not have time to do this themselves. And if you're doing it right and speaking to them correctly, they will refer to you because they want to actually help animals.
And of course, it should be a partnership. Anyone's going to be upset if you're not communicating with them. And especially if we're putting in hard work on our end and then you're going right behind and, treating not as recommended, doing 40, 50-minute treatments. And I doubt any of you do that. But I can see where somebody would be upset if they're putting in all this work and then it seems like the pet is getting worse.
Or if the pet is getting better and they're providing medication and they don't know what's doing it, what is working and what's not. I mean, I've had veterinarians come in and be upset because they're like, well, I don't know if what I was prescribing was working or if the MagnaWave was working, but the animal's better. Like, they want to know what modalities, what the animal is under so that they can make the recommended decisions based on that information. Hiding that is not helping, right?
No.
Not helping. Okay, here's a great one. Should I MagnaWave before or after a horse gets acupuncture? You want to never MagnaWave before a horse gets acupuncture because you will clear the acupuncture points. So always after if needed. Okay. So I think we're almost done. Are you excited about giving things away?
Oh, I'm super excited. I'm excited for you guys.
I'm excited too. Let's see if we have, I don't think we got through half of the questions.
I know, y'all need to start coming to Vet Talk.
Yeah, if you are a MagnaWave practitioner, you are not signed up for Vet Talk. Let's talk about that. Where do you go to get signed up for Vet Talk or be reminded of it? In the practitioner portal on the homepage. Vet Talk is there. You can click on it, register for Vet Talk. You can come every single month and ask these same questions. This is absolutely free. It is every month. It is closed door sessions that we have with MagnaWave machine owners, practitioners, and those in training.
Of course, I have a personal email too as well that is on our page. I think it's Dr. Baumler at MagnaWave PEMF. I could be wrong.
It is.
You can email me anytime. And if you're looking for a more personalized response, I would recommend, email, because we are limited to these live sessions. We typically have about an hour. But if you're sending me videos and pictures and being very specific and you're looking for a more personalized response, email is a great way to go.
Okay, here's a really great one. I've been working on a dog for 1.5 years, and anytime I go, as soon as the mat hits the floor, the German Shepherd jumps on it, lays there perfectly until I'm ready to turn it on. It has helped the animal so much, and the vet is very happy. See, that's the best.
Yeah, because there's no question about that. That dog is enjoying what he's getting done.
Yes.
He knows what's coming and he's ready for it.
Sometimes when we would bring my dad and I used to go to Churchill and we'd bring the machine, like we'd walk into the barn, all the horses would start nickering.
Oh,
like they knew
cute.
us, and it was great when we were going regularly for training. When you have muscle movement, say in a horse, do you stay at that setting or increase gradually during the session until horse says that's enough? Or do you back off the setting if I have movement, even if the horse is comfortable? If you have movement and the horse is comfortable, you just stay at that setting. Mm-hmm. You don't need to make the movement go away. You don't need to decrease. Movement does it, but I usually start low and increase and then just watch the animal from there. If you're on a setting of 1 or 2 and you're getting a tremendous amount of movement on a horse, that's telling me that there's a tremendous amount of inflammation in that animal. So these are the areas where there is some of that sensitivity, and that would be where you would communicate that to the veterinarian.
And I'll also say, if you're at a decent power and you're not getting movement, that doesn't mean you need to continue to go up. Some areas you're not going to see that movement.
Correct.
It doesn't mean it's not working. It just means there might not be as much inflammation in that area.
Yes. MagnaWave has helped one of my clients, elderly mini poodle with anxiety.
Oh.
I bet that poodle is adorable. They are so happy to be able to take him in the car now. It's been years of terrible trips, and now he rides nice and relaxed.
That's awesome.
That is great. We've noticed that a lot with horses that travel and show stock animals that travel to and from events, where they have that anxiety getting in, and then they get to an event and they're tied up, they're tight, there's an issue. Those before and after travel sessions are key, especially in those performance animal. Okay, I think we are done. Let's pick a winner. So should we tell them, well, we're close to being done. Should we tell them what we are giving away today?
Of course.
Okay, so we are giving away 2 video booklets. So 2 of these amazing video booklets. What are these priced at? We're gonna get a price. So these are, they're a couple $100, right? Like $300, $350. What? Okay, so these are a couple $100. These are available in the practitioner portal. Why are they so expensive, you say? They're rechargeable. You could change the videos. It has a mini TV in it, my friends. It's amazing, and we are giving away 2 of them today. So 2 of you will be winning those. We also have
Today,
excuse me. We also have these really, really great backpacks. These are fantastic for traveling. I keep my attachments in there. What I love about them is that they are TSA approved. They say MagnaWave on them, but they also, you can have all of your devices like your iPad or your tablet. It lays flat on the conveyor belt when it goes through, because who wants to have the problem of them stopping you for your MagnaWave and for your tablet? So you don't have to take them out of the backpack. You could just lay it down, easily unzip it, lay it down, go straight through TSA. I like to put some of my attachments, particularly my large loop, which is pretty much all I travel with, right in the front pocket. And then I just put my machine on the conveyor belt like this, and bada bing, bada boom, I am through TSA. So that's why this is just a really great travel backpack. We are going to stock this full of goodies. So this will be full of water bottles, shirts, stickers, hats, nose strips for horses, everything. In there, even HydroWave. So that will be the winners of those. So that's 4 different prizes. We have 8 minutes left, and I thought the countdown threw me off.
There we go. I did too because it was saying negative for a second.
I know, and I was like, okay, cool. So we're gonna do a couple more questions, and then we'll announce those winners. Everybody's saying they like the large loop.
It's nice. That's always what I reach for when somebody wants me to just show them how it works. And I almost always go for like the shoulders or the back on a person when I'm showing them, because I've never seen somebody not have movement or not be able to feel it right there.
Yeah.
Everyone's always got tension in their shoulders.
Yeah.
But I mean, we carry it around all day, so it makes sense.
Okay, here we go. Tammy says, do you think a few sessions before any kind of surgery is beneficial for the client?
I guess it depends on what kind of surgery you're doing. I don't see why not. Because, I mean, before the surgery, it's just another form of anti-inflammatory that's non-medicated. So unless it's something, I guess, certain types of cancer, if you're going in for a surgery like that, cancer removal, you may not want to do that. But I guess it just really depends.
I agree. Let's see. What might be an appropriate referral offer to a veterinarian? I've actually done this before where I would do like with the main thing is making it very clear in writing what you're offering them whenever an agreement is made. Sometimes I would say things like, if you send somebody to me and they sign up for a session, I will give you like 10% of whatever. And they would, if they were buying 8 to 10 sessions for the first package. Not every package from then on, because that becomes a tracking nightmare. So if they come in, and sometimes I would say, all right, if I'm going to charge $50 a session, and I'll give you $5 or $10 of that session. Well, that adds up. If you do 10 sessions and you're giving them $100 and they didn't do anything, that's fine. Some veterinarians really like that. Another way is just to cross promote. If you have somebody come to you and they need a vet, like sending them to that vet and becoming a good advocate for that veterinarian, and that veterinarian doing the same for you, doesn't always have to be some sort of kickback.
Of course.
But yeah, having some sort of agreement. I like to have like a card that you could give them, that when you get that, it has what vet that came from. That allows you to really make sure that you are giving that vet a claim that they need. Let's see.
Connections are everything, and honesty and kindness will get you a really long way. So
yes, and a lot of times it's just they don't understand what it is. Yeah. And when they have, they either think that it's snake oil, like they don't think it works, or somebody has given them, oh well, it's a diagnostic, or it's doing something that then they just have a bad idea of what it is when they don't really understand. Sometimes they think we're shockwave. They lump us into shockwave, and that gets very confusing for people as well. So you're using the MagnaWave at your practice. So what has been some of the results that you found that have been surprising?
It's really great for arthritis on its own and in conjoint with other medications. So I like to use it a lot on hip dysplasia and things like that. Toxins, a lot of the times, who have spinal issues, it works really well on. And some of those with the combination of MagnaWave as well as laser treatments and things of that nature that are more therapeutic, sometimes are better than the medication for them, honestly, because you're going to have a quicker result sometimes. And it's not every time, but some of the times you will see a quicker result with therapeutic modalities than medication. And it's also something that's really nice because, there's a time and place for medicine and things like that. However, it's more common than not that the owners don't want to pump their dogs with steroids and anti-inflammatory medications. If there's an option that is more non-invasive and they feel is a little bit, more holistic, they're typically open to it. So I use it a lot for arthritis and things like that. It's great for broken bones afterwards. It will increase the time of bone healing. It seems like it works a lot quicker than without it. So
yeah, I mean, it's been clinically proven to cut the healing time in bones in half. So that's with regular use. You can't just do it one time, but with regular use during that situation. Here's a really good one. Is MagnaWave best before or after chiropractic adjustments, or both? I have found that it depends on the veterinarian. If you have a large animal vet who's working on or a chiropractor who's working on horses, what we've found is that Sometimes it makes it easier for that adjustment if you do it before. Also, it can help that adjustment last longer if you do it after. So it really depends on how, the chiropractor's hands and how they work. Have you ever worked with any chiropractors that have animal chiropractors?
I'm not. I'm scared to get a chiropractor on myself. So
I know.
I'm not.
It is scary, but I have seen some chiropractors do amazing things. I actually saw a chiropractor. He works on worked at zoos, and he did a full adjustment on a giraffe the other day, and I was enthralled.
That's so crazy.
Like, really, I mean, it was amazing. That giraffe absolutely loved it. Okay, I think we are almost at. Everybody loves the backpack. Love the large loop. Large loop is, people are saying, is my favorite. This woman is saying, this is my local chiro likes the horses done before adjustments because he says it makes it easier.
That makes sense. Like, a lot of the times when we're using it, I like to do it before I'm going to do something that's a little more painful. Like if I'm going to do, have to stretch a dog out for an x-ray or something, but I'm going to give a MagnaWave treatment. Sometimes I'll do it before because it's better to kind of relieve some of that inflammation before I go stretching things out. So yeah, that makes sense.
It makes complete sense. Okay, so, all right. Some of these questions are human-based. We're not going to give the veterinarian human-based questions, guys. So we will go to those questions later on. All right, so our first, we have 2 people with the same name as winners. Do you see that?
Yes, that is wild.
Okay, so our first winner of the video booklet is
Jennifer Redinger.
Jennifer, congratulations. You get a MagnaWave video booklet. Congratulations, Jennifer. And then we will go ahead and give the other person with the same name a video booklet.
Yes, Jennifer Combs Wilbur, you are also getting a video booklet.
Yay! Come on down. No, that's the wrong show. Okay, so congratulations, Jennifer Redinger and Jennifer Combs Wilbur. Jennifer and Jennifer, you guys are our winners of the video booklet. And then let's see, I'm going to Vanna White this. For our backpack, imagine this is stuffed with all sorts of wonderful goodies. We have the winner being
Gina Jacobson and Jared Patterson.
Congratulations, Gina and Jared. You guys, I don't know why that was so hard for me. Gina and Jared, you guys are the winners of our backpacks that are stuffed full of wonderful prizes. Please email MWPrizes, PRZES, at MagnaWavePMF.com with your name and what you want and your shipping address. We want to make sure that we ship these to the correct place. So MW prizes at MagnaWavePEMF.com. Meredith, when is the next live? When is the next office hours?
April 1st.
April 1st. That's April Fool's Day.
Oh. Just kidding. No,
we're not joking. April 1st is the next office hours. Tune in to that. That will be noon Eastern Standard Time on April 1st, unless we're joking. And then it won't be that time. But no, it will be noon Eastern Standard Time. Please go follow our Facebook, our Instagram, MagnaWave PEMF. Check us out at MagnaWavePMF.com. And if you are a MagnaWave practitioner, sign up for that talk. We do this every single month, and we created that to talk to you. Dr. Baumler, thank you so much for joining me today.
Thank you for having me.
Thank you, everyone. Have a wonderful rest of your day.